Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. I first met and interviewed Anne Wanlund, today's guest, back in 2022 when she was just getting her company, Canopie, off the ground. For years, Anne and her co-founder had worked in maternal health advocacy in DC, helping to shape policies that supported mothers and their babies. But it was ultimately her own experience with having a child and experiencing postpartum depression that pushed her into entrepreneurship.
During pregnancy and postpartum, your physical health and your mental health are in complete overlap, but our system really focuses on your physical health.
She set about to build a new kind of maternal health platform, one that would offer scalable access to the kinds of mental health resources that she wished that she'd had. A couple years in, and Canopie appears to be resonating. They've just closed a $3.7 million raise, a huge feat for a new startup led by a first-time founder. In their pilots, Canopie is finding that not only do digital resources make it easier for women to access mental health support, but that they're actually more honest when they do it.
People are often more honest with us with a digital tool than they are with their provider.
In the interview, we get a snapshot of the Canopie platform as it stands today and also learn some of the specific strategies that helped them close a major funding round in the midst of a tight market. Let's get into it. Anne Wanlund, CEO and co-founder at Canopie. Thanks for joining me today.
Thanks for having me.
We wanted to have you on the show to celebrate your recent finished raise. So congratulations.
Thank you.
Remind me how much that you have publicly announced that you've raised?
3.7 million.
3.7 million. That is a huge accomplishment. So I applaud you. This is a tough market. And so we're going to talk a little bit about kind of how you got to this point. Why don't you start by just giving us a recap of what Canopie is and kind of what it looks like in 2024 and what the last couple of years have looked like.
So Canopie is a prevention and early intervention focused maternal health platform. In the past few years, we've really focused on mental health in particular because it is one of the biggest unaddressed, underaddressed issues in maternal health, the biggest driver of maternal mortality and morbidities and cost in the system. We, over this past year, have layered in both depth and breadth to our services to also include social support and services. What we found is that a lot of the moms who are coming to our platform for mental health support also had additional barriers and issues they were facing: food insecurity, housing insecurity, transportation issues, financial issues that some of our partners in healthcare were actually poised to address if they didn't, but they didn't know who was struggling. So up to now, what we've been focusing on is truly a population level approach to maternal mental health and social support. We do comprehensive screening, triage to additional resources and care, remote monitoring, and virtual and asynchronous programs.
Yeah. Let's dig a little bit more into just the mental health challenges associated with maternal health, with having a child. For the folks who aren't in that market, maybe don't have children, haven't had a child, let's just kind of help paint the broader picture of why that is such a big piece of maternal health.
What I like to say is that during pregnancy and postpartum, your physical health and your mental health are in complete overlap, but our system really focuses on your physical health. But if you are dealing with gestational diabetes or preeclampsia or have a high-risk pregnancy, you feel that stress and anxiety. And that stress and anxiety also perpetuates additional kind of physical health stressors and conditions. So it's this vicious cycle, but we're only addressing physical health. And it's just so much of what happens during your pregnancy or postpartum journey is outside of the doctor's office. And a lot of what we are trying to address is that gap. Like what, you leave your doctor's appointment, your OB appointment, maybe you've had 15 minutes to cover some of your physical health main metrics are, blood pressure, weight
Yeah.
gain, et cetera. But there is 90% of your experience is still unaddressed and unsupported. And yeah, that's why we're focused on it.
So tell me about what makes the screening tool special. I use Kaiser Permanente, and they're always hitting me with these digital mental health screening tools, just little drop downs and clicks, whatever. And it doesn't really result in any sort of magical experience with my provider. So what makes Canopy special?
Yeah, so our screening is a combination of those tools that you've already seen, the kind of boring scales, because we have to use those. But we also evaluate risk factors. So, do you have a history of anxiety or depression? Do you have a high risk pregnancy? Do you feel supported at home? Things that are more tangible and relatable, I think,
Mm,
than some of these scales can be. And they also are good indications of what someone might be experiencing, even down the line. We really know what the main risk factors are for developing postpartum depression. We also, are talking about those kind of social needs and asking about those because if you have um, a high kind of numerical score indicating depressive symptoms, and also are really struggling to pay your bills, we're not just going to say, okay, here's some mental health support. There's other stuff we need to address,
yeah.
kind of fill in that picture. And then we also, during that screening process, we're validating how, people might be feeling. We're using language that is non-stigmatizing. We're also just asking people how they feel. Do you feel, do you feel like yourself? Are you feeling like yourself? Are you not feeling quite like yourself? And that's a really important way of understanding how someone who might not be ready or in a place to admit some of the other feelings or struggles they're having can feel safe and connect with that issue.
It- Help us understand the power of digital tools in this space. I think, you go back 10 years and we would have assumed that the only way to do this kind of assessment would be face to face. It's so personal, it's so emotional. And yet we're discovering more and more the power and value of digital tools, even in very personal parts of our lives. So
Yeah.
help me understand a little bit of that aspect of this.
Oh my goodness. There are a few things that are really important to cover here. One is that we have found when we're working with providers and introducing another way of screening for these issues, that people are often more honest with us with a digital tool than they
Interesting.
are with their provider.
Mm,
And um, we also get that in qualitative feedback. I felt weird with my provider in that moment. I wasn't sure what would happen. A lot of moms worry that their babies might be taken away if they describe how they're really feeling. But
mm.
in the comfort of your own home, in that feeling of anonymity and relative security, you're gonna say things that you're maybe not ready to say when under the harsh lights and pressure of an appointment. And I think the other thing that's really what we found is super interesting is so we recently did a case study with GuideWell, and the focus was, can we disproportionately reach and impact Black moms because we know they're underserved and over impacted by some of the issues we're working on. And that was incredibly successful. But one thing we found is that sometimes moms were telling us things that in follow-up from the plan's caseworkers, they still weren't able to admit or talk about with.
Okay.
So that is a gap that we still have, and we have to figure out how to bridge that, how to build even more trust. But certainly digital health tools, if they are designed in an inclusive, accessible, and thoughtful way, can build trust and fill in major gaps.
You just said inclusive, accessible. What was the third term you said?
Thoughtful.
Thoughtful.
Yes.
Give me one example of how a digital tool can be more of those things.
Yeah, I mean, one of the things that is that I feel most proud of is that we use a therapeutic technique or kind of wraparound called compassionate mind training, which means anytime we ask a question, anytime we're delivering information, it's framed in a very non-judgmental, non-stigmatizing, and kind way. And so that you going through the process of sharing really intimate details about what you're going through still feels safe and like not extractive. This
Yeah.
is an exchange of you are telling me something and I'm going to give you something back. And I'm also going to really appreciate you for sharing that with me. And you can really guarantee quality and consistency with a digital tool that, is once you go into the realm of additional support can be a little bit trickier to manage around. So it's
Nice.
yeah, it's
Love
one.
it. All right, let's talk about your raise. We're having this call because you completed a $3.7 million raise, which is particularly noteworthy in this market. It's been a tough market to raise. And so, is there anything you think that distinguishes Canopy, your pitch, um, above and beyond just, hey, we're a great company, of course, that people would want to fund us. What was it about you and the timing and what you came to market with that you were able to finish this raise this year?
Yeah, I would say that what allowed us to finish it was also the thing that made it harder because
Okay.
um, Canopy is a very mission-driven company. I'm stubborn about how we're going to do things and what we will and won't do. And as you know, in healthcare, the incentives don't always line up to kind of improve um,
Does
a
that
patient's
does that
experience.
mean that you turn down certain projects because it doesn't line up, things that could have been lucrative
Or,
or
I'll be honest with you, we had investors say, if you change your model, if you capture more of these dollars over here with your intervention, we're really interested.
okay,
You're a great founder. We love what you're doing, but you're leaving this on the table. And it's not that we're leaving that on the table. It's just that we need to address the problem that we've identified first and do it well in order to expand to the other
okay,
things eventually. And we would be diluting our impact and our mission. And I think that's what really fuels Canopy. And that's why we've been successful so far is that we're able to connect to the issue and the partners we're working with on a deeper level than just this looks a little bit different than what you're used to seeing, but not that different. Like we look really different.
okay, okay. Oh, how so?
Um, I never shy away from sharing with investors or partners my own personal experience. And
Hmm.
I think that changes the tone of the conversation immediately. So I think that was a strength during our fundraise. And frankly, it's a strength many to most of the customers that I work with right now are moms. They get it. We connect on a different level. And it's sort of the opposite of an old boys club, I would say,
Mm,
which is really it's kind of moms looking out for moms, and
yeah.
that's a beautiful thing. And I would say that having strong values and mission alignment attracts a certain type of investor, and I love our investors. They will never wonder why we are making a certain decision. It's just very clear they get why and how we make decisions. Um, and they think that that is the reason we're going to succeed is because we're really focused and
Okay.
and values driven. But
Okay. So,
yeah,
so you were intensely mission focused early on. That may have turned off the wrong people, and eventually it attracted the right people.
yes.
Um, any other sort of intangibles that you feel like helped you get it over the line in terms of pilots, in terms of sort of how you presented your case?
Oh, definitely. Yeah, I would say that our commercial traction also. I mean, we have really strong commercial traction, and if we didn't have that, it would have been impossible.
Describe
Um,
that for me. What traction have you seen?
yeah, I mean, we've just been able to, I mentioned, for example, the work we've done with GuideWell. They're a multi-plan, they own multiple plans, they're a very large, innovative plan. And I was able to take to investors the results and say, look at, they're standing behind this work, they're expanding this work, and here's a case study to show exactly what we've done and what we're going to do with others. So that hasn't just been important for us in terms of, you know,
Was
being better at what we're doing and trying to expand on that, but
so
investors, yeah,
so the GuideWell piece was critical. Was that
yeah,
a pilot? Was that a paid
yes,
contract?
uh,
That was a
a
pilot.
pilot, yeah, that has been.
How did you nail that pilot?
You're gonna love this story. It was actually the very first connection we made with GuideWell was from the startup health interview that you did with Canopie years ago. And we were really thought partners. They are incredibly mission driven too. And so for a while, it was just kind of exchanging learnings and them kind of also going through this incredible exploration with their members and even with their own team about the issues that they were struggling with and the gaps they were seeing. And that's how that started. And since then, a lot of the partnerships that we do have or that are launching next year have been really kind of similar issues that we now have proof that we can address. Rather than just saying, we
Hmm.
think we can do this, we actually know we
Yeah.
can. Yeah.
Um, Anything you learned doing that pilot in terms of if you were to do it again, if you were to give advice to an earlier founder trying to prove out um, any guidance that you'd give to them on how to do your proof of concept with a partner like Guidewell?
I think that approach it as a true partnership because your partners are putting resources and time and effort into the pilot too, and they're going out on a limb to do something good and better for their members or their patients. And I think sometimes it can feel when you are the vendor or the contractor or whatever that you are delivering way more than but you need to see it from the other perspective. They've got a huge mountain to climb too.
Is this your is this your biggest raise to date?
Definitely, yes.
Okay. Okay.
Yeah.
So closing 3.7 million, that's a big deal for an early stage company for a founder. What are you going to be able to accomplish with this money? What are you excited about doing with the funds raised?
Yeah, so we are, my biggest goal was to prove that we could deliver a impactful mental health solution at scale. We've had close to 20,000 moms come through our platform across the US at this point. And now we're going to add additional services, both. So one of the gaps that we see is that after you've been screened, even by Canopy, there can be a long wait between when you actually get to talk with someone and that moment. So we're filling that gap with psychiatric nurse practitioners and licensed clinical social workers. So more of a care management and kind of full experience of getting that asynchronous, virtual, and immediate care that we know so many moms need. So that's so as of today, we're in network with United Healthcare, several BCBSs, and we're expanding to additional health plans and MCOs this year. So that's very exciting. We, have a lot of demand for that already, so it's really just meeting that demand. Um, and then we're going to be looking at additional ways that we can improve preventive care next year. So, we've got we actually know quite a bit about what's going on with a mom during pregnancy. And so, looking at those risk factors, did a mom have gestational diabetes in the last pregnancy? We know all of that. And so we can also take on that additional piece of connecting them to additional resources to manage that.
How do you feel like you've changed as a CEO? How have you grown as a founder and CEO over the last couple of years?
I so I think so my background is in global health. And so I came in with a lot of ideas about how things should work and, probably a little bit of naive optimism. And now I have informed optimism and I know where we
Especially
need.
now that the raise is done. Now it's informed optimism.
Yes. So now it's really about I've just learned so much about healthcare and where we can have the greatest impact and where we can affect change now and where we can affect change later. And I also think that I don't know, I guess um the most important thing to me is just that Canopy has an impact and can grow in the way we need to grow. And so that's just
Yeah.
that's my kind of tunnel vision. That's all I think about really.
Yeah. We talk a lot about stopping to acknowledge and to celebrate wins. How did you mark the moment of solidifying this raise?
Well, we did, have a little team like celebration and get together, and it closed a few months ago. But we did announce it, and certainly that has brought a lot of really great attention and potential partners to us. But the truth is, the way I think about a raise is it's a necessary input. It's not the raise in itself something to celebrate. It's what it allows us to do and an acknowledgement of what we've accomplished so far. So absolutely, it's just extremely exciting to have the means to realize our vision.
Yeah, it's the jet fuel. It's not the mission. It's not the
It's not the mission.
destination. It's
Yes,
not the mission or the destination, but it is the jet fuel.
it is the judgment. Yes,
And
exactly.
it's the market validation.
Yeah,
Market
absolutely.
validation. And like you said, it's a chicken and egg thing. You start getting that validation leads to other interest, which leads to mission um, progress.
Right. Yes,
Well,
exactly.
and it has been exciting to watch you grow and progress. I mean, first time we interviewed, just a baby company, just, a team with a dream.
Yeah.
And for you to close a big round like this, even while really sticking to your guns and staying mission driven, it's beautiful to see. So I appreciate you giving me the update today, and I'll be excited to see what you do with these funds and how you progress over the next year.
Thanks, Logan. It was such a pleasure. And yes, we were a baby. We're still a baby, but we're a toddler now.
Yes, yeah. Your goal can be to keep your baby, you keep your company just one phase of maturation ahead of your actual child.
Yes, exactly. It's a great goal.
All right, all right. Take care and be well.
Thanks, Logan.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.